Today's update. And you'll notice there's no sign language interpreter today, but the stand-up has been captioned in real time on our live stream on the Ministry of Health website. Again today there are no new cases of Covid-19 to report, so our number of active cases remains at 22, and all of those cases have recently returned from overseas and are or were in managed isolation. There is one person who remains in hospital stable on a ward. That is in Auckland City Hospital. And just to reiterate, no cases of community transmission. So our total of confirmed cases of COVID-19 remains at 1,178, the number we will continue to report to the World Health Organization. Yesterday our labs completed 4,530 tests, and we have now surpassed over 400,000 tests, with 402,000 tests having been processed since we started testing for COVID-19 back at the beginning of February. And just to put those case numbers in context, you will have heard overnight the Anthony Fauci from the USA talking about the possibility of 100,000 new cases per day in the USA. That would be the equivalent in New Zealand of around 1,500 new cases per day, which is more than the total number of cases we have had since the start of this pandemic. So worldwide the number of cases continues to increase, and we're seeing of course resurgences in some countries where controls, including lockdown controls, have been relaxed. And obviously yesterday's developments in Victoria and Australia, particularly in those suburbs in Melbourne, where they have reimposed some conditions around people's movements, are a reminder that community transmission in the future is a real possibility, and we may here need to take measures to, local measures to counteract community transmission if it occurs again. We will be watching carefully and continue to work on a daily basis with our Australian colleagues to see what's happening there. So a key takeout for us all, and you'll hear me say this more than once today, is we need to just remain vigilant. Things feel very much back to normal here in New Zealand. We are almost unique in the world in that respect. However, we do not want to give up our hard-won efforts and the opportunities afforded by being in Alert Level 1 and our ability to have our domestic economy and how we can live our daily lives compromised at all. So I just want to reinforce those key public health measures. They remain fundamental to our success now and in future. Most importantly, if you are sick or your child is sick, please stay at home or keep your child home. Do not go to work and don't go out visiting or socialising. If you have symptoms of cold or flu-like illness, ring your doctor or healthline to get advice about getting a test. I'll come back to that. Good hand hygiene remains a simple and effective tool, not just for preventing COVID-19, but many other communicable diseases, respiratory and beyond. Please keep track of where you have been. The easiest way to do that is to have downloaded the COVID Tracer app and use it. Many premises now have the QR code which you can quite easily scan. And please make sure your contact details with your GP or on the app are up to date. And as I've said before, even having the app and having registered means we have your up-to-date contact details, which, should we need to call you, make it much easier to do so and increase our likelihood of doing so quickly. Just one other point I'd like to make before I go on to an update on some managed isolation contacts. I've talked right since the start of the outbreak about showing compassion for people who may have COVID-19. It is relatively rare in this country. We are fortunate in that regard. There is no stigma associated with having the infection. We have seen it can affect people from all walks of life across all demographic and ethnic groups. I met with Air New Zealand's Chief Executive, Greg Foran, yesterday, and he commented to me that some of his staff and crew members, particularly those flying international routes, have been facing some hostility and suspicion in their local communities. Again, this could be your friend or a family member. Please do show tolerance and support them. Remember that it is in their very best interests to make sure they are keeping themselves and their families and their communities safe. They do not want to create COVID-19 infections in New Zealand, and I know they are working very hard and focused on ensuring that doesn't happen. An update on the people who left managed isolation between the 9th and 16th. Reminder that first of all, we had already some time ago followed up the 55 people who had not completed 14 days for a range of reasons, mostly compassionate reasons. So we have closed off those people. All other people had been in managed isolation for a 2-week period, and it has now been more than 2 weeks since the last of those people left. Around 60% of those people have not only been contacted, they have had a test either before they left, that was 800 of them, of the 2159, the balance have had a test since, and there are 366 people who have been further contacted who have also been asked to get a test, and we expect more testing to come in. There is also a group of around about the same number, actually 367 as of yesterday, whom we have made contact with on a number of occasions, including leaving phone messages and or texting, but who have yet to respond. And I've asked the team just to have a look at why that might be. It may be there are language difficulties, and we want to make sure that we're finding out why there is this group that isn't making contact. Let me be clear. It's, at this point in time, they present a very, very low risk to the community, recalling that they had all completed the 14 days of managed isolation, which has been fundamental to our response since the 9th of April. So for those people who may have been contacted and haven't yet spoken with Healthline, please do so on the number, which is 09302 0408. And finally, on the NZ COVID Tracer app, just to reiterate the point I made earlier on, please continue to encourage people to download the app. The success of our response, if we get community transmission, and you will have heard from Victoria that even with a number of cases, I think they had around 75 yesterday, their resources are stretched. One of the things that makes the job of contact tracing easier and successful is if we have people's up-to-date contact details, and this is one of the key values of the NZ COVID Tracer app. So please do download that. Businesses, if you could put up your QR posters if you haven't already, and register, then that will mean we are good to go and in the habit of using that technology to assist our contact tracing efforts. I can assure you that the Ministry of Health remains working incredibly hard on all aspects of the response to make sure we are ready, not just to prevent cases coming in, but should we get a case of community transmission for whatever reason, or a community case, that we can respond really quickly and stop any further transmission. We must all continue to be vigilant and play our part. We certainly are, and I'd encourage all New Zealanders to continue to do so. We have got this far by acting together. We will continue to do well if we continue to act together. I'm open to questions.
From a health perspective, what would your response be to concerns about people reportedly sharing rooms or sharing bathrooms in the managed isolation? From a health perspective, why is that a problem?
If people are in the same family group or sort of small bubble within managed isolation, that's fine. The reason in managed isolation we like each person or small family group to have their own bathroom is, again, just part of our managing the risk down to the lowest possible level. The reason we want to do that is, of course, the 14 days is the gold standard. If people have come in and may have been infected or brewing the infection, they've time to have got over it, and of course with the testing we are very likely to have detected it. But we don't want cross-infection within those facilities, hence the physical distancing requirements, and there's very strict requirements around not shared bathrooms.
So we've had reports in that people are being forced to share communal bathrooms with strangers. That is pretty concerning to you?
It would surprise me because of the nature of the accommodation. They will have, each hotel room will have its own ensuite facility, so I'd be very interested to know. The question may be if there has been people using some of the public toilets as well. That would surprise me because people are in their own hotel suites with en suites.
Is there ever a situation? Sorry, just to follow up one more thing. Is there ever a situation where someone would have to share with a stranger? like if there was, say, a double room with 2 beds, would that ever be a requirement as part of the managed isolation?
Is this an in theory question, or is
this
something?
Someone said that they're
right,
doing
yeah.
that, and my understanding was that it wasn't happening.
Yeah, I would be very surprised. I'll check with our all of government team that's that Air Commodore Webb is leading, just to check that. It would surprise me greatly if that was the case, because this has been one of our strict criteria, and in fact one of the reasons why we felt we couldn't approve the proposal that was being put forward by the universities to bring students in was because the accommodation arrangements included shared bathrooms. That was almost the main sticking point. So this is one of the areas we're very strict about.
How are we managing our quarantine differently from Melbourne, which mean we won't get transmission from hotel staff?
Well, I've seen some articles written about the Melbourne situation. I think 2 hotels where they've had people working there, and I think at least in one it was possibly security staff there who were externally contracted security staff. We've got really clear protocols, and the staffing of our facilities is done by people who are working already in the public service, the wider public service, and in particular you've seen that big increase in the use of Defence Force personnel for security in some of those roles as well. So it's not straightforward running these facilities, and that's why we did the review last week. We found some things that could be improved, and we want to continuously do that to improve.
What measures are in place in our facilities that will protect Kiwis in there from getting transmission from staff?
From staff, or transmitting to staff?
From staff.
Well, I think what happened in Melbourne was that one of the staff, security staff, was infected by someone in a facility, and that's how it got out to the community. Again, the protocols are very clear, designed to stop guests infecting each other and also guests infecting staff members. So there is a whole range of measures in place. For example, symptom checks on staff at the start of each day. We've tightened up or expanded the use of masks in the guests coming in and for staff who are working there. But just a reminder too that these protocols have been in place and working effectively since the 9th of April, where we have seen no cases come out of those facilities into the community, either people who have been in managed isolation or staff who have worked there. And as part of our surveillance testing through alert level 3 and into 2, we did quite wide testing of each day, airport staff and staff working at facilities, and didn't find expanded the use of masks and guests coming in and for staff who are working there. But just a reminder too that these protocols have been in place and working. About domestic flights, not specifically, but they will be aware of the protocols. Staff that are working there are in place. Just a reminder too that these domestic flights have been in place. I understand that New Zealand has moved to making masks available for people working domestic flights. Should they about domestic flights use them? Not specifically, but they will be aware of the protocols. Staff that are working there. Just a reminder too that these protocols together. I understand that New Zealand has moved to making masks available for no specific expectation. Should they about domestic flights use them? Not specifically, but they will be aware of the protocols that are working there. Just a reminder too that these protocols together. I understand that New Zealand has moved to making masks available for no specific face masks. Should they alert about domestic flights use them? Not specifically, but they will be aware of the protocols that are working there. Just a reminder too that these protocols together. I understand that New Zealand has moved to making masks available for no specific face masks. Should they alert about domestic flights use them? Not specifically, but they will be aware of the protocols that are working there. Just a reminder too that these protocols together. I understand that New Zealand has moved to masks. Should they alert about domestic flights use them? Not specifically, but they will be aware of the protocols that are working there. Just a reminder too.
Released on Friday indicated the
with some other functionality, so that there was a sense that it was creating more value than just simply registering. It wasn't essential that we had it there, so the main reason was ensuring we could have some other functionalities. Both
there led to lower uptake of the government app because people were confused by all the options or just didn't think it was necessary?
Yeah, it may well have. However, I think we've given I give a pretty regular plug since, and one of the things we did do early was to developers of those other apps to use the QR code that is the one that we use on the COVID Tracer app, so they don't have to have a separate. Got the app, but the code didn't work for me, and there is a very specific code that works on the app. Ideally,
expand on what we're looking at.
So I guess what I'm talking about here is as part of our planning for what we're calling, an increase of infections. We are looking at what specific measures you could put in place, and so I'm very anxious to consider all the options exactly. And if you had a localised outbreak, yes, you might provide and require masks to be used in that locality.
Yourself and the ministry have the numbers of registrations of the COVID NZ app. Do you have the numbers of Kiwis actively using it and signing into